Hello, my name is Dr. Jason Semprini with the University of Iowa College of Public Health. I am a health economist whose research focuses on evaluating health system policies, state policies for their effects on health outcomes and health equity. For this study, I had the pleasure of working with my colleague, Abdinasir, an economist with expertise in housing and health, and Gabriel Benavidez, who is now Professor Benavidez at Baylor University. The intersection of our expertise in health services research, housing and health, and the epidemiology and geography of health equity led us to this project. Our work, which will be published in the fall of 2023 in a special issue of Health Affairs, is titled Medicaid Expansion Lowered Uninsurance Rates Among Non-Elderly Adults in the Most Heavily Redlined Areas. Most of the health policy and health services research community will be familiar with the sea of evidence showing that the Affordable Care Act's Medicaid expansion increased access to care for millions of Americans, and that by expanding Medicaid, states began reducing racial ethnic disparities in uninsurance rates. What is less known, however, is how this bedrock policy differentially impacted access to insurance not just by race, but by exposure to racism. In this study, we model exposure to racism, specifically structural racism, as exposure to historical redlining at the census tract level with data from the Mapping Inequality Project. With a simple pre-post expansion, non-expansion group design, we found that Medicaid expansion had little effect on uninsurance rates in lower redlined communities. Only in the highest redlined communities did Medicaid expansion have a significant impact, lowering uninsurance. Moreover, this finding was consistent across non-Hispanic Black, non-Hispanic White, and Hispanic population groups. We all know that racism, not race, is the driver of racial ethnic health disparities. We are among the first to explicitly model exposure to racism in a health policy evaluation. These results suggest that Medicaid expansion was a critical tool in the pursuit of health equity. States that fail to expand Medicaid continue to deny the benefits of affordable insurance to millions of low-income Americans, especially those who reside in historically redlined communities. Thank you.